Because of my TB diagnosis, I was told that I was a danger to my baby and to others. That was one of the hardest moments of my life. In 2011, I was diagnosed with MDR-TB, a type of TB resistant to most drugs and harder to cure. But thanks to the Global Fund partnership, today my children and I are alive and healthy. With support of Challenge Facility for Civil Society, which received funding from the Global Fund, I lead TB survivor organization in Indonesia and advocate for better gender-inclusive care for people with TB. And I believe that, yes, we can end TB.
The good news is that since 2000, global efforts towards ending TB have saved 79 million lives. The bad news is that this progress towards TB elimination is now under immense threat because of global funding cuts on programs that diagnose, prevent, and treat TB, and other crucial programs that fund communities that support this service delivery through mechanisms like Challenge Facility for Civil Society.
The global resurgence of TB is extremely concerning. TB is a disease that knows no borders, and the epidemic on our hands is a growing threat to our collective security, well-being, and prosperity. Global partnerships such as the Global Fund and the Stop TB Partnership have a critical role to play in the fight against TB by mobilizing resources, technical expertise, political will, and community leadership to deliver essential TB health responses where they matter the most.
Today, the heaviest TB burdens fall on the world's poorest and most vulnerable. Over 80% of TB cases and deaths affecting the most marginalized people in low and middle income countries. In Papua New Guinea and across the world, the Global Fund is investing in the delivery of truly equitable, sustainable, and cost-effective TB interventions, which is only possible when communities are funded and placed at the heart of the health response.
Unfortunately, stigma, fear, and high cost of medications associated with TB remains a major barrier that prevents people affected by TB from seeking treatment in formal healthcare settings. For the first time in Pakistan and across the region, we have evidence documenting these barriers through the stigma assessments supported by Challenge Facility for Civil Society. TB responses must also prioritize the economic inclusion and empowerment of communities affected by TB to ensure their economic, social, and cultural rights are protected. That's why investing in community systems and community-based organizations are a critical component to ensure effective TB responses that are impactful, cost-effective, and accessible for all.
This is our call to action. Support the fully resourced Global Fund 8 replenishment with an investment of $18 billion to ensure the continuation of essential HIV, TB, and malaria services and save up to 23 million lives.
Mobilize increased domestic resources to scale up TB prevention, screening, diagnosis, treatment, and care services, as well as increase funding for research and development to support innovations in diagnostics, drugs, and vaccines.
Strengthen health and community systems in collaboration with communities, civil society, and technical partners to provide high-quality TB care, accelerate towards UHC, and enhance preparedness against pandemics and drug resistance.